Do you find Singapore's healthcare system and how is it compared to other countries?
It is futuristic and effective in a way because it is we do have the Medisave, the MediShield, and the Elder Shield, and these are expenses that you don't think of currently for normal people. You tend to use your money for what you need now. This is not actually available in Philippines. In Philippines, you have to get your own insurance, medical insurance, to pay for your bills, medical bills.
Do you find Singapore's healthcare system effective? Why?
Yes, because it is actually making me save money, which normally, if I would want to save money, this is something that I would only use for the education, but not for medical expenses. So it is forcing me because definitely someone will get sick in the future, or someone will be out of job because of illnesses. So we really need to save money for that. And MediSave is really a good practice to keep a portion of your income.
Do you know how the government subsidizes healthcare in Singapore to help you?
No, because normally we use our company's insurance to pay for the hospital bills, and I've only used the MediSave uh, yeah, for those expenses that was I've incurred, but I'm not familiar with the government subsidies.
How far are government measures an effective way of keeping healthcare costs manageable in Singapore? Explain.
I can't answer that because I'm not really familiar with the government's way of handling this.
What do you think should be done to improve Singapore's healthcare system?
I've heard about the CHAS, which is meant for the elderly, I think, and the lower income families. But I think they could do more for the elderly because if they don't have any families that will support them, it will help them a lot. I mean, they need more support from the government since they couldn't get a job to support that. And another thing is for the Medisave, hopefully it could be used also for the medical expenses, not only for the hospitalization, but for the minor medical expenses. It doesn't have to be the full bill, just a part of it, because that.
Do you know how the government subsidizes healthcare in Singapore to help you?
Yeah, there are different subsidies in hospitals to ensure that the lower income families get the most subsidies. And there are also schemes like Medifund for Singaporeans who still cannot afford for healthcare despite having Medisave and Medishield.
How do you find Singapore's healthcare system and how is it compared to other countries?
I think that Singapore's healthcare system is very efficient as Singaporeans pay relatively low taxes as compared to other countries who offer free healthcare.
What do you think should be done to improve Singapore's healthcare system?
We should make it more affordable for the elderly who do not have any savings, and for the unemployed.
Do you find Singapore's healthcare system effective? Why?
Yes, I find it effective. Singapore has high standards of healthcare despite the government only spending about 3% on it.
How far are government measures an effective way of keeping healthcare costs manageable in Singapore? Explain.
It is effective to a certain extent because it makes sure that even low-income families are able to afford healthcare. Healthcare.
How do you find Singapore's healthcare system and how is it compared to the other countries?
Oke, Singapura lebih berkualitas dan bermutu bila berbandingkan dengan Indonesia dari segi semuanya termasuk pelayanan dan perobatan.
Okay. Do you find Singapore's healthcare system effective? Why?
Ya, karena mereka memberikan semua pelayanan yang diperlukan.
Okay. How does the government subsidies in Singapore help you?
Mereka mengadakan Medisip.
How far are government measures an effective way of keeping healthcare costs manageable in Singapore?
Mereka sangat memperhatikan sehingga kan mereka ada Medisip.
What do you think should be done to improve Singapore healthcare system?
Melakukan sesuatu kegiatan yang bersifat positif di hospital. Dah.
How do you find Singapore's healthcare system and how is it compared to the other countries?
I think it's good compared to most countries as they provide services that are needed most of the time and they ensure proper treatment is done.
Okay. Do you find Singapore's healthcare system effective? Why?
Yes, as many of the services needed are provided.
Okay. How does the government subsidies in Singapore help you?
They have things like MediShield, Medifund, Medisave, and so on to subside the cost of the bills.
How far are government measures an effective way of keeping healthcare costs manageable in Singapore?
The government do everything they can, such as providing the things that I've mentioned above to keep it affordable.
What do you think should be done to improve Singapore's healthcare system?
Nothing. I think it's good enough.
Okay, thank you.
Hello, I'm going to interview you now about healthcare.
Okay, go ahead.
How do you find Singapore's healthcare system and how is it compared to the other countries?
Compared to most other countries, it's quite efficient. It's about the 4th best in the world, and it's efficient and low cost and has been a proven track record in managing healthcare costs. Number 2, please.
How do you find Singapore's healthcare system effective and why?
It's quite effective in that it covers almost close to 80% of the population through the various medical health schemes like Medisave, Medishield, ElderShield, and Medifund. Thank you.
Thirdly, how does the government subsidies in Singapore help you?
It helps me, like say through Medisave, is amount set aside for dependents like children and spouses. It's meant for daily ward charges in hospitals and for doctor fees. You have schemes like MediShield. It's a medical co-insurance scheme, usually meant for long hospital stays and paying medical bills. Thank you.
Question number 4. How far are government measures an effective way of keeping healthcare costs manageable in Singapore?
So far, the government has managed at 4% of our GDP growth. It's also managed through what I know is the 3 M's, which is the Medisave, the Medishield, and the Medifund. We also have a new scheme called the CHAS, C-H-A-S, which is a Community Health Assist Scheme, which is meant for the lower or middle income to receive subsidies for dental or medical at our nearest GPs, which is the general polyclinics. Thank you.
Lastly, how do you think should be done to improve Singapore's healthcare system?
I personally feel that we should take more care of the elderly, especially the aging population and those retirees, to cover more those with chronic diseases, and perhaps to tap more on the private sector, for example, the GPs, the general polyclinics, for the primary health care of the elderly, for example, through schemes like the CHESS, and also maybe tap on the FMCs, which is the family medical clinics, which are for the neighborhood.
Hello, I'll interview you now about healthcare. First, how do you find Singapore's healthcare system and how is it compared to the other countries?
Okay, Singapore's healthcare system is quite good, but their medical treatment is expensive. Compared to other countries, like in Philippines, the medical treatment is cheaper.
Second, how do you find Singapore's health system? Is it effective? Why?
Oh, it's really effective because of their good population, clean and green, and their medicine and treatments are also in advance.
Thirdly, how does the government subsidies in Singapore help you?
I feel that Singapore government should also provide some healthcare subsidies to foreigners, as a foreigner do also help to increase the sum of Singapore population.
Fourth, how far are government measures an effective way of keeping healthcare costs manageable in Singapore?
Oh, I have no idea as a foreigner, but I've heard that many are willing to pay for the medical expenses as it provides quality healthcare.
Lastly, what do you think should be done to improve Singapore's healthcare system?
I think Singapore's system should be the medical treatment should be cheaper.
Thank you.
You're welcome.